Welcome back guys to another video. Today we're gonna be looking at the channel's most amazing top 10. The title will be, when I upload it to YouTube, will be top 10 ways you will probably die. So let's get into it.
My name's Danny Burke. In 2015, the World Health Organization released their list of the top 10 causes of death depending on where you're from in the world. Now of course this is quite morbid, but that doesn't mean that it's not interesting. Based on these statistics, this is the top 10 ways you will probably die. Don't worry guys, it's just a video title. I've looked at the highest causes of death in developed countries, like the ones you're probably watching this from. These are just stats. I'm sure you all have nice, long and healthy lives ahead of you. In at number 10, we have breast cancer, which kills 15.6 people per 100,000. Breast cancer can affect men, but it's usually found in women. It's a cancer that, as the name suggests, develops in the breast tissue, starting out as a lump and then growing wildly out of control. If caught early, there are a growing number of medical techniques to help deal with it, and despite making it onto this list, survival rates in developed countries are between 80 to 90%. Moving on to number 9 now, we have kidney disease with 18.1 people per 100,000. Our kidneys are the organs that filter waste and excess fluid in our body. When diseases affect them, they can lower the kidneys' function dramatically, causing them to not adequately filter our blood. Fortunately, there are a number of different treatments out there for it, even when it's in the later stages. Transplant patients actually have an 85.5% survival rate, but due to complications or late treatment, it still claims many lives each year. At the number 8 spot now, we have diabetes. Now this is really a developed country problem, where it kills 22.6 people per 100,000. Quite simply, diabetes is caused by high blood sugar levels over a long period of time. Now normally, the pancreas produces insulin to help store and use the sugar, but low insulin leads to diabetes. It is a lifelong disease that millions of people around the world aren't even aware that they have. Medication, surgery and lifestyle changes can help manage diabetes, but it is sadly a lifelong disease. Moving on to number 7 now, we have bowel cancer that kills 27.5 people per 100,000. This is a cancer that affects a person's colon, rectum or large intestine. It is almost always caused by old age or lifestyle factors such as diet, obesity, smoking or a lack of physical activity. As with other cancers, it can aggressively spread. The best way to stop bowel cancer is before it even gets started by screening for it and any cancerous cells being surgically removed. Coming in at number 6 now, we have lower respiratory tract infection. A common term for this is pneumonia, and it kills 38.2 people per 100,000. This term includes any negative affecting of the airways such as bronchitis, influenza and whooping cough. They can be caused by viral infections or by parasites. At times, antibiotics can be used to treat the infection, but because it's such a wide, encompassing illness, treatment is decided on a patient-to-patient basis. At the number 5 spot now, we have chronic obstructive pulmonary disease, which kills 42.6 people per 100,000. Its main symptom is long-term poor airflow. Symptoms include shortness of breath and coughing. The most common cause is smoking, but genetics and air pollution do also contribute to the numbers. It's estimated that 1 in 20 people suffer from this on the planet. Most people don't even realize they actually have it until they have to do something like walking up the stairs, and then they just find they're constantly out of breath. Moving on to number 4 now, we have lung cancer, which kills 49.5 people per 100,000. Cigarette smoking is the primary cause of developing lung cancer. One of the reasons it's thought to kill so many is that it's difficult to spot lung cancer until it's already in its advanced stages. If it's caught early though, 54% of people will survive on average. If it's not and the cancer ends up becoming advanced and inoperable, the survival rate plummets to just 4%. Next up at number 3, we have Alzheimer's, killing 60.1 people per 100,000. Alzheimer's is a degenerative disease of the brain that worsens over time. It may start with a person losing their short-term memory and then struggling with language, orientation and behavioral issues until the person is almost unrecognizable as their former self. We still don't fully understand Alzheimer's, but we do know it's mainly caused by genetic factors and that it doesn't normally start in people until the age of 65 or older. Also, because of how drawn out the disease is, it's also one of the most financially costly. Moving on to number 2 now, we have stroke, killing 64.7 people per 100,000. A stroke is poor blood flow to the brain. This is one of the most vital bodily functions, obviously, and so the results can be quick, devastating, and permanent. The main cause is high blood pressure. If a stroke doesn't result in death, it can cause paralysis on one side of the body and also leave the victim with speech and language problems. Learning the early warning signs of a stroke can be a literal lifesaver if you know someone at risk. Alright, finally now, at number 1 we have heart disease at 144.6 people per 100,000. This is the number 1 people killer in developed countries and describes a whole range of conditions that affect the heart. Ischemic heart disease is the most common and involves a blockage of the coronary artery that carries blood to the actual heart muscle. Now, with reduced blood flow, the heart can't beat as well. Over time, this increases the risk of a heart attack. A particularly severe one can lead to death in minutes or even seconds. Alright guys, I won't lie to you, that wasn't the most uplifting video I've done. A little bit depressing, wasn't it? But remember that a lot of these apply to elderly people, so you probably have nothing to worry about. But I still think it's good that we're informed about these kind of things. Who knows, maybe one.
Right, that was actually quite interesting. I hope you love that video. I hope you smash that like button. And I'll see you all there.